Welcome back to the Awesome Physio YouTube channel. Today we're going to be looking at why am I getting pain over my forehead. A really common symptom that people will present with when coming in for an initial consultation and chatting to one of our expert therapists is that they will talk about getting pain over the forehead area. Although there can be lots of different causes for this, we're going to be talking about the most common mechanical triggers that we would see in clinic, but also the most common areas of referral that might be triggering your forehead pressure. So what are some of the conditions that can trigger pain over the forehead area? So one of the most common things that we see is something called temporalis myalgia or temporalis tendinitis. So your temporalis muscles attaching around the top of the head here, so just over the arch of the jaw up into this area, are absolutely vital to help us chew and to help us open and close the mouth. The main thing that they do is that they close the mouth obviously when we're chewing and prevent retrusion or encourage, that backwards movement of the mandibular, so the jaw. It's absolutely vital to help us kind of chew, talk and do stuff that we do day to day. If we've gone through a particularly stressful period, for example, and we're biting down, so we're triggering bruxism, or we're biting down into the jaw, or we might have had tightness up into here that's cascading into tightness up into the head area. This can cause local pressure and tightness to form around this area and up into the forehead. What someone will typically present with is this feeling like a dull ache or pressure around this area. It might be worse when they're chewing or eating. It might be building up the pressure here. And a lot of the time people will say that when they push up into these muscles, that will reproduce pain over the forehead area. So what we'd be talking through as a therapist is when did it come on, onset, what makes it better, what makes it worse, and a lot of the time on observational palpation you'll find that it will just feel really tender both sides, and a lot of the time you can reproduce the pain into the forehead. The second common condition that can trigger pain around this area can be linked to your frontal sinus. So if we've got sinusitis or inflammation of your frontal sinuses that sit just above the nasal area, so just above the nose. One of the most common things that can trigger sinusitis, particularly if it's a new onset or an acute flare-up, can be an infection or a virus that's triggered that inflammation around the sinuses. Sometimes people can have it for a really long period of time, so they could be suffering from chronic sinusitis. A lot of the time this is the case. They'll have different peaks and troughs causing pressure around this area. A lot of the time they'll have different medications to help reducing that inflammation, and they'll kind of know their specific triggers, whether it's when they get a cough or a cold, or potentially even linked to hay fever or some kind of aggravation into this area, so sinuses and the nasal area. How it typically presents with people is it feels like there's like a deep pressure. They almost feel like they want to push in around the forehead here, and they might have other systemic symptoms with it, where they might feel a little bit malaise, a little bit low on energy, or a little bit under the weather, that might be triggering that sinus pain. What they also might talk about is having kind of discharge from the nose, or having like a runny nose, or other symptoms of a cough or a cold that might be triggering that frontal, or adding to the symptoms of that frontal sinusitis. Another cause that we might be thinking about in terms of referral or pain referral over that forehead area might be linked to a capsular pattern or aggravation of the capsules of the joints of the neck. So your neck movement side to side, looking up and down, is influenced or introduced by your facet joints in the back of the neck, other structures as well, but that main movement or the main joints are your facet joints. What can happen if we've had some kind of trauma, or we've had repetitive patterns, maybe looking or turning into an awkward position? It might cause local pain and soreness around the back of the neck. So it's normally or typically unilateral, so one-sided. Sometimes quite a sharp pain, although there might be a bit of a dull ache around that area. It's normally worse when we typically either push the joints together or we stretch the capsule, so it's normally a very specific combination or vector of movement that typically causes the pain, and it's more common to start possibly in the neck and then refer over to the forehead. So what people normally present with is that forehead pain and pressure being a secondary pain to the aggravation in the neck. So what we would look at in clinic is assessing movement through the neck, you know, palpating up around here to see that when we push on certain joints, if that also reproduces the pain into the forehead. The final thing that I wanted to talk about, which kind of links to the facet capsulitis or pain around the joints of the neck, can also be from trigger points of the surrounding muscles. So deep knots in the muscle, which again might be from trauma, if they've had a whiplash injury or a fall, that's triggered pain around the neck and the jaw. Or again, that repetitive pattern over time that's caused key muscles to tighten and become sore. What can happen is it can give local pain over the belly of the muscles, whether that is your SCM muscle around the front here, or your scalenes, or your traps, or your levator scapulae, so all the muscles that surround around. What we'll find on examination is pushing on that area will be quite tender, but you might find even around here or around the base of the head that sometimes that can actually refer pain over the forehead, and people might suggest that actually when you push on that point, it brings on that horrible pain that they had over the head and over the eyes. So it's really important when coming into clinic that, you know, we're assessing the whole area, we're seeing the onset, you know, the key triggers that brought on the pain, what typically relieves the pain, and how it is progressing. What this then does is give us a really good idea. Are we the right people for you? Do you need some kind of hands-on treatment if that's right for your symptoms? Or do we need to refer on to examine or investigate further what might be causing your forehead symptoms? Finally, what might be some of the red flags, so the warning signs that we would be thinking about with forehead pain? So one of the big things is it's not potentially reproduced from mechanical movement. So when you're moving the neck or you're loading it mechanically, that doesn't really have any impact on the pain. If it's suddenly getting severe, so it's peaking in pressure or tightness up in that area where it's come on for no apparent reason, it's waking you up at night, or positive on valsalva, so pressure, so coughing, sneezing, it feels like it reproduces that really deep, horrible pain through that area. Or if you're feeling really unwell and you're being sick with the pain and the pressure over the forehead area, or even if you're getting any visual changes with it as well, so blurry vision or double vision, or you've noticed any changes in your vision, all of these would warrant speaking to either a GP or going straight to A&E, you know, speaking to that expert person who would be able to assess these symptoms. What should be happening even when you go into a clinic though, is they should be able to assess any red flags or warning signs and send you off straight away to speak to the relevant specialist.